Welcome to Fit Resort and Spa. Here you'll find it all, the latest in fitness, health, fashion, and beauty.
Well, yes, and you're definitely beautiful.
Well, part of what contributes to my beauty, I found, is the great care that I take of my skin.
Yes, I love your feminine side when it just shines through like that.
You know, it's there for someone to find. No, the fact is there's a huge trend over the last couple of decades that people have been getting into, altering the markings of time through cosmetic surgery. That would seem fairly frightening to some. It certainly does to me.
Right.
But today we have some alternatives to surgery.
I love it when we show alternatives. That's what we're all about here.
It's true.
They are called non-surgical facelifts, and now you can have sensational skin without going under the knife. And here to tell us all about it is board-certified dermatologist Dr. Glynis Ablon. Hello, Dr. Ablon.
Hi. Thank you.
Can we call you Glynis?
Absolutely.
It's a great name.
Whatever you want.
I guess what we should first cover is what can we do, all of us, just to take care of our skin, so maybe we don't even have to worry about any of these other steps.
The earlier you can protect your skin, the better off you are, because then you're dealing with prevention and not having to repair the damage you already have. So
moisturize out of the womb, basically.
Well, actually, most people think that moisturizers make a difference. In dry skin, yes, absolutely, that helps. But oftentimes, a sunscreen alone is all you need. I show this one because it's a nice one you can get in any drugstore. An SPF 15 is very important, and to wear your sunscreen every day, I say like brushing your teeth.
Is that
Make
right?
a party
Even in the
program.
winter?
Yeah.
Absolutely, absolutely. You're still getting the UV rays, and our ozone layers decreasing, so it really is important.
So let's say we haven't sunscreened or moisturized.
Okay.
What are some basic, simple things that we can do to treat our skin at home?
Continue the sunscreen. Even it's never too late to at least make some prevention. And then at that point, there's nice things that are non-invasive, things like topical vitamin C's, things like topical vitamin E. We know that internally these are antioxidants, and they do help our body. And so many years ago, not about within the last decade, they came up with some topical forms of these vitamins, and they do seem to be showing some great promise in.
And these things you can just go to the drugstore, you can get these.
You can
and
go
smear
certain
them on.
ones. One important thing is I usually say at least a concentration of 10% is the minimum. One of the complications is that there are a lot of products out there that carry these, but in much lower concentration. So if they actually do anything, we're not really sure.
Do they repair skin damage?
We know that they actually do a lot of prevention for the future, and they're showing that they do some repair. How much will be determined over the next few years. The more studies we get, the more we can say that there is.
Now, what about Botox? I've heard a lot about this, and it sounds pretty scary.
The term itself is often scary. The results are amazing. Botox has been around for actually a number of decades.
It's botulism, right?
It is actually botulinum toxin, but it's very, very dilute. It is just a small amount.
That makes me feel a lot better.
It's a very small amount, and it's actually been used for people that have different kinds of facial abnormalities.
And it's injected, isn't it?
And it's actually injected.
Can we see a picture of
I think we have a This is someone frowning before an injection of Botox, and then the next
Just
picture, the next picture is actually trying to frown with the Botox actually already injected.
Yeah, you say trying to frown because what it actually does.
Because you actually do weaken the muscles.
Which sounds dangerous to me. There's got to be a
But you can't frown.
But you're always happy.
You're always happy. So it sounds like a great
much
thing.
more
So there
joyous.
must be areas where you can't use it.
Right, absolutely. And there are risks. Some people are doing it actually on the neck, but it can cause different kinds of muscle abnormalities and things like that. So it can be dangerous if used in the wrong area.
And what about your laser techniques now that I've heard so much about?
There are different lasers out there. The most important thing is to realize that a laser is based on wavelength. So a certain wavelength will treat a blood vessel abnormality. A certain wavelength will treat a sunspot abnormality. A certain wavelength will treat wrinkles. We have different different lasers for each different.
And what kind of effect is it like a burn that it causes on the skin?
It depends. That's the laser you're talking about is actually for wrinkles. I think we have a picture of a vascular laser that will show you. This is what's called a spider araneus, which is actually a blood vessel on the face. That's before laser, and the next photo that we have should be after, and you can see it's a little bit shiny from the picture, but the vessel is actually gone.
Is that right?
And that is a vascular laser. Yeah, the permanent change, you can get new vessels. It doesn't prevent you from getting new ones, but it does actually get rid of the ones that
you can
do
also
have.
get rid of wrinkles with lasers?
Different laser, absolutely. It actually, a laser that is absorbed by water will actually destroy the cells, and then actually you can wipe away the cells and have new skin.
Is that expensive?
Those kind of lasers usually are.
Yeah.
They are not cheap.
Okay.
Yes, but they can make dramatic differences.
Now, what about our power peels? This lunchtime facial procedure that people are doing just to get like what they call an instant facelift, basically?
These are actually microdermabrasion. It's actually a machine that has like a little glass rod, and at the bottom it actually sucks your skin up against the rod. Almost like little sand particles hit the skin. So it takes off the top layers of skin. It's superficial. The question is how much deep improvement can you get?
Well, we have a procedure going on right over here.
This is actually,
we go and check?
We'll go check it out.
We have Laura and our esthetician Ivy?
Ivy will do wonders, as she always does.
All right.
Well, you got a tough job, don't you? Hi, Ivy. How are you?
Fine, thank
Now,
you.
what are we doing to Laura here?
This is actually an alpha hydroxy acid peel. When we talk about peels, there are different types of peels. As we mentioned, the power peel. This is an alpha hydroxy acid peel. Cleopatra used to do these years and years ago.
I just saw that movie, and Liz Taylor looked great.
That's why.
She looked so
That
good.
was why. It's actually the bottom of wine barrels. You can actually get out the sediment, and that has a tartaric acid in it, which is actually an alpha hydroxy acid. And so it's similar to what we're doing
And
here.
I guess there must be then different levels because a peel
Right.
would seem to be
There
also.
are absolutely different levels. Just
Yeah.
as there are different lasers, there are different levels of peels. There are peels that go to certain depths, and depending on how deep you go, determines how much improvement you get.
So,
in
what is the
skin.
deepest peel?
The deepest peel would be something like a phenol peel, and that is very deep. That is where you have a lot more complications. It actually can be cardiotoxic, so people, it's not used as much as it used to be.
Forget about that.
Lasers have taken over that area in a lot of ways.
Now, are we taking skin off Laura today?
We are. Ivy, go ahead and tell us what you're doing right now.
Basically, we're rejuvenating the skin. I have already prepped the skin with alcohol, and I've just now wiped our glycolic acid on her skin. Do that twice, and we're going to give it about 2 minutes
Okay.
time, and she may want a little fanning.
Oh, really? That'd be nice. Oh, I see.
Can we peel you a grape, too?
Now, are these kinds of peels, how often could one do those? if
These
one-
ones you can do every week, once a week. They're really
that
nice.
would be okay.
Absolutely. They're really nice because they take off the very top layer of skin.
see.
They can help irregular pigmentation. They can help acne. They can help fine wrinkles on the face. These are nice. Again, this is an alpha hydroxy acid peel, so she's not. She can basically go and put makeup on in a couple hours and go about her day.
Now, can we do this at home as well?
You have alpha hydroxy acids in different kinds of products that are out there. They are much lower concentrations, so I do recommend using them in the morning if it's not too irritating on your skin. But you have to remember that an alpha hydroxy acid is at much lower concentration than you're going to get in a peel like this. So you
Okay.
can get much more.
He's very
She's
good
looking
at
very
this.
happy, yeah. I excel at this.
You do?
This is great.
Gosh, you're so good at everything.
Now we've neutralized with water.
Okay.
She'll just be ready to go in just a few seconds.
So you neutralize the facial
The acid.
The
acid with water. Okay.
We're going to come back in just a moment and see the results of this peel. Welcome back to Fit Resort and Spa. I'm Mark Goodman here with Andy Matheny, who's learning how to do a spray.
Well, yeah, well,
Post-peel spray.
a post-peel spray. Yeah, actually, this is our science project. If you're just joining us, we're learning how to be facialists here. And what is the purpose, Dr. Glynis, of the post-facial spray?
That's actually just some glycositrates that kind of cools the skin and brings down any burning or tingling that you can have right after a peel.
So, did I miss the part where we sort of peel the face off?
Yeah, where's all the skin?
Actually, what an acid does, these glycolic acids, actually cause exfoliation of the skin within the next 24 hours. You'll have a little bit of peeling, a little bit of redness, and that's about it. She can wear makeup in a couple hours.
How are you feeling? You feeling okay?
Great.
You look great. You have it's kind of shiny glow kind of thing going on there.
Yeah, you look beautiful.
Glow is good.
Glow's good.
Glow is very good. Well, Laura Lee, thank you so much. You look wonderful. Ivy Halford, thank you very
Great
much.
job.
And Dr. Glynis, you were fabulous. Thank you
you for
very
having
much
me.
for the great information. All right.
Bye-bye.
I have to fan with this.
Okay,
That's
please.
right. He's going to fan.